healthcare system? Why was there a problem? And what does the Affordable Care Act try to do? We're gathered together at a time of economic crisis. The news headlines are focused on threats to our national security around the world. I'm here today, and we're here today, to talk about other threats to our economy and national security, diseases. So why was the healthcare legislation needed? We have, for those of you in this room, you have some of the best healthcare in the nation. But the truth is that our healthcare system is a patchwork. We have private sector, we have 1/3 of Americans are enrolled in a government plan, Medicare, Medicaid, TRICARE, the military, the Veterans Administration. So it's a patchwork. Very few of these systems relate to each other. We spend 18%, that's almost 1 out of 20 cents on the dollar on healthcare. We pay on average over $8,000 a year for health. In comparison, we spend 8% of our GDP on defense. But did you know that we rank 49th on life expectancy in the world and 37th on the health status of our nation? Furthermore, we have 50 million uninsured people, okay, which is a shame in a country that is as great as ours. Did you know that a bankruptcy occurs every 30 seconds in America because people can't pay their medical bills, and 45,000 people die in the United States of America as a result of not having health insurance every year? Look at this slide. You see all those states that are in purple? That's the equivalent of all the people that are uninsured in our nation. When you add it all up, 50 million people, the equivalent of the population of those states. And it's not just a problem for the uninsured, because you're paying for the uninsured already. $1,000 of your premium is cost shifted to pay for those who don't have health insurance that comes to our hospitals around the country. And also, the structure of medical practice has not changed in more than 50 years. Most are practicing with 5 doctors in a small practice. They have little information about how their practices are working. They get little feedback from you as patients about how they're doing. And they keep their records in longhand, which leads to medical errors. Did you know that there were 1.6 million medical errors last year? 1.6 million people were injured, and 100,000 people lost their lives due to medical errors in America? That costs our economy about $30 billion a year. And information technology is a critical element of everything: banking, how we shop, how we move these days. But did you know that the healthcare industry pays only 2% of its budget on health information technology? 20% of primary care practitioners and only 10% of hospitals use electronic health records. So there's no coordinated system of care. And then we have these pandemics. 550,000 people die every year in our country due to smoking, the #1 cause of death, and obesity. 68 million Americans are overweight, 1/3 of our nation's children. It's leading to a diabetes epidemic. In fact, as a result, it's predicted that this generation of children, 1 out of 3 of them will develop diabetes, and this may be the first generation of kids that is not as healthy as their parents as a result. It's leading to a tsunami of chronic diseases: heart disease, cancer, stroke. 4 in 10 Americans say they have a chronic disease, and 75% of our $2.6 trillion healthcare budget is linked to these preventable factors, and yet we spend only 3 to 5% of our healthcare budget on prevention. So that's like waiting for your car to break down before you take it for maintenance. We have a sick care system. We don't really have a healthcare system. We spend anything when a person gets sick. We spend nothing to keep them well. And baby boomers, they're aging, and as a result, we're going to see a doubling, $4 trillion in 2015 of healthcare costs, to where 20 cents of every dollar will be spent on healthcare. So, healthcare costs have risen by 50% over 4 years. But did you know that a RAND study says that Americans get the right treatment only 55% of the time? And 50% of physician care is not based on best practices, really what the standard of care should be. So the bottom line is we are simply not getting what we pay for, 18% of GDP. And that led to a perfect storm, okay? So there was a call for presidential and congressional and public leadership to do something about our sick care system. And how are we going to heal our ailing healthcare system. And for more than a century, Americans have debated about whether and how to expand health insurance. Theodore Roosevelt called for healthcare for all early in the 20th century. He put healthcare reform on his agenda. Truman supported it, but he didn't make it a priority. Kennedy championed Medicare. Unfortunately, he was assassinated before it could pass. Johnson then established Medicare and Medicaid in 1965. Again, it was surrounded by the same sort of debate today. It was a socialist program. Today, a beloved program, all these years later. Nixon tried, Carter attempted, Reagan expanded Medicare, but it was repealed. Clinton tried to reform, but he did establish a very important program, the Children's Health Insurance Program, which extended insurance to kids. And then Obama made history. He signed into law on March 23rd, 2010. It's the most significant advance in health care since Medicaid and Medicare. And it requires every American, almost every American, to carry health insurance, but it compels insurers to cover new consumers, even those who are already ill. And what it does is it, remember I told you about it, how it's a patchwork system? Well, it has a number of provisions. It's not just about having every person have health insurance, it's about redesigning the system so that it is more coordinated and that it provides innovations, 21st century innovations in care. So the idea of this system is to really provide CPR for our sick care system, to revive it, to breathe new life in it. How? By covering all Americans with quality care, effective care, and reducing costs, by creating a prevention revolution. Remember I said 75% of costs are linked to preventable factors, so how can we prevent disease in the first place? And then research. Research is medicine's field of dreams, from which we harvest new findings about the causes, treatment, and prevention of disease. It establishes a comparative effectiveness research institute to really look at what works and for whom. I want to just briefly then talk about how the legislation affects all of us and what's in it. It creates, as I said, a modern integrated system. It increases efficiency, effectiveness, and equity of the system. And importantly, it enriches benefits for all of you. It's not just about the uninsured. It's about us all, about all people with insurance. It requires employers, again, to cover people, all employees, or pay penalties. It decreases healthcare costs. It integrates health information technology. Remember I said that wasn't part of our system today. It increases payments for primary care, so the doctors actually can talk to patients, not just do procedures. Because right now our healthcare system rewards doctors for procedures and for having patients in the hospital. It doesn't reward them for keeping them at home. And in lower cost interventions as well, and greater support for prevention. It eliminates, it gives patients a bill of rights. It eliminates the discriminatory healthcare practices that have existed in the past, where an insurance company will deny you coverage because you have a pre-existing cancer, like high cholesterol or cancer. It takes away lifetime caps. If you have a catastrophic illness, your insurance company can say, we're not going to pay anymore. And shamefully, insurance companies have discriminated against mental illness. Mental illnesses that are as painful, disabling as heart disease or diabetes, but we've stigmatized these illnesses in the past, considering them not to be real illnesses, just like heart disease. And also, insurance companies were allowed to charge women more because women might get pregnant, and therefore their premiums were higher than men's. So that will be erased in this care. And parity for mental illness. How is this going to cost? Well, the CBO, the Nonpartisan Congressional Budget Office, released a report that said over 10 years the law will reduce the federal deficit by $110 billion by creating efficiencies and redesigning the healthcare system. And also, the Affordable Care Act says to insurance companies that only 20% of the premium can be spent on non-medical expenses, like CEO paychecks or administrative expenses. 80% has to go to pay for benefits for people. And in 2012, consumers are going to receive up to $323 million rebates from insurance companies that spent less than 80% of all premium dollars on healthcare in 2011. The new healthcare law fosters changes in medical practice. As I said, it enriches benefits for everyone at this table. It creates team-based medicine, greater emphasis on primary care, and health outcomes will be more transparent. Now, we all are hearing about the individual mandate, and Jeff will be talking more about this because that was one of the key elements of the challenge in the Supreme Court. Why do you have an individual mandate? Well, it's not government. It's not you're going to get your care through the government. I mean, this is still a private sector based system. But the individual mandate says that everybody has to have health care, so you spread the risk across people. And if you only purchased insurance when you got sick, then there would be no funds to pay for everybody. It would all be used up. So you need a healthy risk pool as well as people who are sick. And then the law also creates state-based insurance exchanges. These are like insurance marketplaces where you can shop for a range of different options if you want to. I mean, if you already have insurance through your employer, it's not going to change it except to enrich it. But you can, if you don't have it, you can shop depending on how much you want to pay for deductibles or cost sharing. So again, that's the insurance exchange. It doesn't force Americans who already have health insurance to change plans or purchase a government plan or anything like that. If you have health insurance already, you don't have to change it. But, as I said, it enriches it. No lifetime caps, no pre-existing condition exclusion, parity for mental illness, no out-of-pocket expenses for prevention, because we want to give people incentives to get those preventive services, like mammograms and prostate tests and colonoscopy. And also young adults can remain on their parents' insurance till they're 26. It doesn't force Americans to buy insurance they can't afford. It provides subsidies for those who can't afford it, from 133 to 400% of the federal poverty level. That would be between 14 and 44,000 for individuals, 30 to 82,000, 92,000 for a family of 4. And if the insurance policy costs more than 8% of your income, then you don't pay a penalty or taxes, as it's now being called. It does help sick people obtain insurance, and it's estimated that 36 million people will 36 million people get insurance, and as many as 17 million people have pre-existing conditions, so they will be helped by this law. It doesn't hurt small businesses. Employees or businesses under 50 employees will be exempted from the laws, and only ones with more will face a penalty if they don't provide health insurance. Now, I mentioned that it redesigns the healthcare system, that it provides innovations. So some of the things that will happen is doctors under Medicare will be paid one premium for a patient to keep them well, so that because did you know that 1/3 of patients are readmitted within a month under Medicare? Because their doctor doesn't follow them, because the patient doesn't hear the instructions of what medicines they're supposed to do. So the idea is to coordinate care. And there will be an at-home model to reward people for staying at home, for home-based health care, which was totally de-incentivized under the current healthcare system. And medical malpractice reform. Some doctors say that their costs are going way up, so $50 million given to states to look at tort reform issues. And then accountable care organizations. So this is that integrated system I was talking about, where doctors already and nurses and home-based healthcare and community-based healthcare are working together to create a system of care like a Mayo Clinic in your community. Why do people go to Mayo Clinic? Because it's integrated. They use health information technology. The doctors talk to each other. They use ancillary care. How do we do that in community settings? And that's what accountable care organizations are all about. And what has it already achieved? Because while the heart of the bill goes into effect in 2014 when the individual mandate kicks in, there have already been a number of accomplishments, which I just want to take a minute to tell you. First of all, it's established a prevention and public health fund, so that it has $10 billion in it. Some of that's been taken to offset some other things under the budget cuts going on, but the idea is to give communities money to create preventive interventions to keep people well, to create that prevention revolution I talked about, to go from being a sick care to a healthcare system. There's a national prevention strategy that's been created. Food and menu labeling is in the bill, because now with an obesity epidemic, we want people to be able to see more clearly what's in the food that they purchase, and when they go to restaurants, fast food chains, to see what the content and the calories will be, and that will be coming soon. So there are incentives for schools to have healthy school meals, because kids get 50% of their calories at home. Healthy businesses, they're in the bill. There's workplace incentives so that employers offer their employees workplace wellness programs. They get tax credits for that, and healthy communities. Already, you can see these people have received a preventive service. 82 million people have already gotten a free preventive service under the bill to date. 5.3 million people, seniors, because the donut hole has been filled in part, have received prescription drugs. 17.6 million children with pre-existing conditions no longer can be denied coverage. 32 million Americans are expected to be then insured, and 150 million Americans will no longer have a lifetime limit on their health insurance. So CPR for our healthcare system, that's what the Affordable Care Act is trying to do, to achieve health equality and quality in our healthcare system, health equality for all Americans in the 21st century. But then 26 states, led by Florida and the National Federation of Independent Businesses, brought a suit against the law, wanted to stop it from being implemented with 4 key issues: the Anti-Injunction Act, individual mandate, severability, and Medicaid expansion. Can the Act tell the states that they could expand Medicaid? And that's where I'm going to turn it over to Jeff to tell you about what the Supreme Court did and how it ruled.
Thank you.